The next section of our systemic and local infections chapter looks at skin infections. Most skin infections are mild, but some can be very severe. If severe skin infections are left untreated, life-threatening sepsis can occur. When we look at this section of the chapter, by no means are you going to be an expert in skin infections. It takes practice identifying and treating these types of injuries. As long as you're able to identify that there may be something going on with the skin, the dermis, or something deeper than the dermis, then we need to refer our athlete or patient to a physician for further evaluation. So let's jump into some different skin infections. Our first one is folliculitis. Folliculitis is an inflammation of the skin's hair follicles due to viruses, bacteria, and fungi, with bacteria being the most common pathogen causing the infection. This folliculitis occurs when a pathogen enters a damaged follicle. This can occur from shaving, excessive sweating, abrasions or cuts to the skin, and inflammatory skin conditions such as acne or dermatitis. Blocked follicles can also promote bacterial growth. Folliculitis typically appears as pus-filled or red pimples around a hair that may look like a rash. The pimples are itchy, tender to the touch, or painful. They may also ooze and crust over. When we look at these signs and symptoms, these are typically very superficial folliculitis. As we go deep, these signs and symptoms appear as a lump under the skin, and typically a large mass with that lump. In order to treat folliculitis, we need to keep the area clean by washing often with soap and water. Use warm, moist compresses to help promote clearing and drainage of the pus in the follicle. And if folliculitis spreads or does not resolve in a few days, we should refer them to a physician. Contact dermatitis is a non-contagious infection that occurs when an object or substance comes in contact with the skin and causes an allergic reaction on the skin surface. This can be of two different types: irritant contact dermatitis or allergic contact dermatitis. Irritant contact dermatitis affects the epidermis and occurs often to the face and hands. Soaps, cosmetics, and chemicals are often common irritants. Allergic contact dermatitis is a hypersensitivity to a substance and can be caused by poison ivy, perfume, cosmetics, detergent, latex, and chemicals. All of these are typical triggers that we see in a person's body. Signs and symptoms of dermatitis vary in severity. Signs and symptoms of contact dermatitis include red, itchy, blotchy skin that may appear as a rash. Irritant contact dermatitis is most often dry, whereas allergen contact dermatitis creates blisters that ooze fluid. The fluid dries with a crusty appearance. Both types of these contact dermatitis may cause tenderness and pain in the area. The irritant or allergen can leave a distinctive red rash, mark, or shape on the skin that identifies the actual object that was on that area of the body. For both types of contact dermatitis, we need to identify the allergen that caused the contact dermatitis and promptly remove the allergen. We need to also wash the area with soap and water frequently to remove the irritant or allergen. Athletes can also use over-the-counter topical medications to dry the blisters and decrease itching. We need to try to make sure that the dermatitis does not spread to other parts of the body. If it does spread to other parts of the body or does not improve after 2 weeks of treatment, then the athlete must see a physician. Cellulitis is a local bacterial infection that typically occurs at the skin of the lower extremity. However, cellulitis can occur at any portion of the body. If this is left untreated, the infection can become systemic and life-threatening. When we look at cellulitis, there are specific risk factors that include people who have athlete's foot, open wounds, a weak immune system, other skin conditions, and swollen extremities. Once a person is infected, we see that the bacteria enters through this open wound, break, or crack in the skin. And once they do become infected, we see the typical signs and symptoms. The skin is very inflamed, red, swollen, hot, and point tender. The person may also have a fever and other general infections, signs and symptoms including illness, fatigue, muscle aches and pains, sweating, and chills. Because of the swelling that is in the area, the skin also appears to be stretched. In order to treat cellulitis, the athlete must see a physician immediately for oil or intravenous antibiotics. Our next infection in the skin is verruca. These are common warts and caused by human papillomavirus or HPV that enters the body through a crack in the skin. These can be located anywhere on the body, but most commonly appear on the hands and feet. Signs and symptoms include raised bumps that may be light brown or gray in color with a scaled surface. Some warts on the bottom of the feet are flat and painful due to weight bearing. These plantar warts may appear to have black dots within them, as these have dried blood vessels that have grown into the wart. We can treat common wart with over-the-counter wart removal preparations. If these do not work, we can refer the athlete to a physician that can utilize electrocautery, which is burning the wart, freezing the wart, or cryotherapy, or some sort of laser treatment to remove the wart. Our next group of infections are tinea. Tinea is a fungal infection that occurs in the body, and we have 4 different types of tinea that we're going to look at. If it's on the body, it's called tinea corporis, or ringworm. If it's on the head, it's tinea capitis. If it's at the groin area, it's tinea cruris, or jock itch. And if it's at the feet, it's tinea pedis, or athlete's foot. When we look at these different types of tinea, they're typically transmitted when an athlete comes in contact with contaminated surfaces and the fungi enter the skin through a crack or a break in the skin. Athletes are typically more prone to these types of fungal infections if they sweat frequently, practice poor hygiene, or have minor skin wounds. These can also spread on the athlete's own body once originally infected. When we look at signs and symptoms, even though they are all tinea, we do see different signs and symptoms for each type. On the body, ringworm first appears as red, bumpy, scaly rash that then develops into a red ring with raised edges. On the other hand, with tinea pedis, the skin appears scaly and peeling. The skin may be red and cracked, especially between the toes. For tinea capitis, the skin may be itchy and appear red and scaly, with loss of hair and pus-filled sores at the infected area. The athlete may also have a low-grade fever with swollen neck lymph nodes. Lastly, tinea cruris appears as red, scaly skin at the groin, which may have blisters that ooze. This is very uncomfortable and itchy for the patient. To treat these, we separate into 2 different groups. We can treat tinea pedis and tinea cruris the same way. Typically, it involves self-treatment with antifungal medications, which are available in sprays, powders, and creams. Tinea corporis and tinea capitis are typically treated under a physician's care with oral or topical prescription antifungal medications. Impetigo is caused by Staphylococcus aureus, or staph bacteria, and secondly by Staphylococcus pyogenes, which is strep bacteria. This infection typically can occur at any age, but most commonly in children and adults who have skin-to-skin contact with other adults. It is a very highly contagious infection and is spread through physical contact with the infected person. The bacteria do not have to enter through a break or cut in the skin to be transmitted. Therefore, because it is highly contagious, We must not have the athlete participate until they are cleared by a physician. Impetigo has also been associated with upper respiratory infection that occurs 2 to 3 days before signs and symptoms of infection show up. Typical signs and symptoms include pustules that enlarge into blisters, which secrete a yellowish liquid. The secretion becomes crusty and honey-colored when dry. The affected area itches and appears red, but is not painful. For treatment, we need the athlete to see a physician for topical, prescription antibacterial medication, and oral antibiotics. We also have to have the athlete practice good hygiene, which includes gently washing the area with soap and water. Herpes simplex virus is classified into 2 types. Type 1 is responsible for producing cold sores. Type 2 produces genital sores. We will focus on type 1, herpes simplex, or simply cold sores. However, both are highly contagious types of infections. For herpes simplex, the virus is transmitted via close contact with an infected person or touching objects that have the virus. Once a person is afflicted with herpes simplex, the virus remains in his or her body for life. However, it can remain dormant in the facial nerve tissue for a long period of time. Typically, if we see an outbreak on the person of herpes simplex, they occur due to ultraviolet light or direct sunlight, fever, trauma, or hormonal changes in women. Signs and symptoms first include painful blisters on the lips, tingling, burning, or itching at the area that the outbreak will occur. The athlete may have a fever, sore throat, and swollen glands. The blisters in this area then erupt and are visible on the lips, mouth, gums, and/or throat, and they may break and a clear yellowish fluid start to leak out. Because herpes simplex is a virus, there is no medication that exists to destroy the virus. We typically treat it symptomatically. For treatment, we should have the athlete frequently wash the area with soap and water, utilize saltwater rinses, take over-the-counter pain-relieving medication, and apply an ice pack to the area if pain exists. If these symptoms persist for more than 2 weeks, then his or her physician must examine the area. Last but not least, we have methicillin-resistant Staphylococcus aureus, or simply MRSA. MRSA causes a serious bacterial infection. This infection can enter the body via an open wound or mucosa and cause a life-threatening situation. There are several risk factors that may lead to death from MRSA, including old age, organ transplant, and residence in a nursing home. MRSA is resistant to the methicillin antibiotic, which is similar to penicillin or amoxicillin. So, because it is resistant to these medications, it is not easily treated in all cases. When we look at transmission of MRSA, it can be from skin-to-skin contact with an infected athlete. MRSA has also been transmitted in overcrowded or unclean settings. In this situation, the bacteria enters the body through open wounds, cracks, or breaks in the skin surface, as well as mucous membranes. Signs and symptoms of MRSA include fever, chills, and other flu-like symptoms, the presence of a wound that does not heal, or a lesion, pimple, boil, or rash that erupts on the skin. The lesion may look like a spider bite and turn into a painful abscess. For mild cases, it may only require draining the lesion. For severe cases, it may require a long course of antibiotics to fight the infection. If the lesion does not readily heal, then we need to refer the athlete to a physician for evaluation. To prevent the possibility of spreading MRSA, all equipment tables should be cleaned and disinfected immediately before another athlete uses that equipment or table.